There was chaos at a Yoville, Johannesburg clinic as residents and Operation Dudula members blocked foreign nationals from entering. The standoff was sparked by a viral WhatsApp message calling on the foreigners to gather after the borrowing of their compatriots from other public health facilities. The South Africans got wind of this and also arrived, and as a result, parents were left pleading for their children's rights to treatment. ANC's Theodore Mashele reports.
In the heart of Yoville, a small clinic became a stage for a bigger national debate.
I said to today, the situation is very tense.
Who is entitled to treatment when facilities are stretched to the limit?
The issue of illegal immigrants who comes to a country as per Immigration Act of 2002, it states clear that he must seek a medical insurance from the Director General of Home Affairs. To say, I'm going to seek for a medical care in South Africa, then the Department of Home Affairs will then issue a medical insurance, which stay clear, which is for 3 months, and then it will go back home.
Been here for 20 years, but now they're even refusing for someone who's got a permit to go inside. So what must we do?
They don't allow anyone to get inside. But tablets are being sold here in front of the gate, right in front of the gate. What about this lady who is in charge of this clinic? What is he saying?
There are issues with other clinics. The foreigners are blocked from entering, and when they are blocked, now they are all flocking to Yoville. Upon them flocking to Yoville, the residents, they said, no man, when we come into Yoville clinic, we find that our clinic has run out of the stock of medication. So what we are going to be doing is to make sure that we block everyone from coming in. And I have been trying to re-emphasize that this is just the communities from all the political affiliations. Others are not even politically affiliated. It's not about Dudula. But outside there, it has been made to be saying Dudula is blocking the people. But what really sparked the issue of today is the voice note which was circulated yesterday, which was calling all foreign nationals from across the length and the breadth of the city of Johannesburg to come and gather here. Fortunately, I was able to meet the gentleman. This is a gentleman who had made that video. We spoke with them. We spoke with the leaders of EFF. We do have Dudula here. You understand? So we've got a number of the stakeholders. Mine was to say we can have a way of finding solution without necessarily.
In South Africa today, clinics are battlegrounds. On the one side, there's Dudula demanding that illegal immigrants are deported, demanding that they be deported. On the other, JMPD officers often deployed under EFF to control city government. However, the law says police should be neutral. We still have Madlanga Commission. We had Nhlanhla Mkhwanazi telling us the rot of this, politicians influencing police. But the political reality tells a really different story here in this saga at the clinics. And behind it all lies a bigger question. Who really benefits? Ordinary South Africans? Regular folks? Those who don't have private health insurance to have a private health covers? Or the cartels trafficking the medicines, trafficking South African medicines across borders? That is the question you need to ask you. When you see all these politicians out there, they give nothing. I would say, I could actually bet for you that these people give F about what's going on in the clinics. You need to go back and listen to Nhlanhla Mkhwanazi. All right, Nhlanhla Mkhwanazi just had a testimony at Madlanga Commission. And after that, we also heard from, the minister, the National Commissioner of Police, telling us how upset the Minister of Police was when they actually nail it, the big five, when they actually found the people who were responsible for this drug cartel, all the syndicates in South Africa, organized crime. How upset he was. He said it was the first time in his life ever seen a minister so upset.
Was discussed. The minister became visibly angry at this point. I, together with Kumal, were still.
Can I ask you why? Why did the minister become visibly angry? Do you know?
Yeah, what made him angry was that in the proposed plan somewhere we said the PKTT is not going to take further cases. It was first in my career to see a minister angry that police have done a good job.
Think about that. When you think about this clinic saga, think about that. The testimony from Nhlanhla Mkhwanazi about the links of drug cartel and politicians and what the National Commissioner said and Mhlanga Commission. Then you can actually contextualize this thing at the clinic. What we're dealing with here. Oh no, it's not a simple thing of being meaningless. I can hear all people talk about, Dudula, yada yada. No, this is not just Dudula. Everybody, all communities here, they are up in arms. It's community protecting their resources from drug infiltration, from drug cartels that are using the illegal immigrants, the vulnerable community, the vulnerable people. So it's not just this stuff here. It's not really, no. It's not that simple. It's not that simple as, suddenly, people are so crazy standing at the clinics. They don't have anything else to do. No, bigger than that. We need to start with actually explaining the law, what the law says. The Constitution of South Africa is clear. Police must be political neutral. That's why we have Madlandla Commission because of this interference. Now, when you have the JMPD reports to the city of Johannesburg, which is not to any party, it reports to the city. It's responsible for the city, not a party. When you look at how the EFF behaves, they think that JMPD is responsible for them. They're not. They're not responsible for any party. Their legal mandate is to enforce traffic bylaws and support crime preventions, meaning support the police. In theory, there is no political party, not ANC, not DA, not EFF, no party. When I say no party, can deploy the JMPD. But theory and practice don't always match. Don't always match. So we can go to the second thing about this coalition. Through this coalition in Johannesburg, of course, the EFF coalition is that the South African, gave the EFF this vote to do this stuff. When you see any party that does things you don't agree, other South Africans gave them a vote to do this nonsense. So what you do next year is that you don't sit and not vote. You go and vote. You register to vote and vote them out. Vote them out by voting the alternatives. You got so many parties in South Africa. You do not have to worry about two-party system like we have here in Australia. You got so many choices. All right, so you don't have to keep up with this nonsense of EFF. So EFF holds the MMC for public safety in Johannesburg. That means they influence where the JMPD is deployed. All right, because of the MMC for public safety. That's their influences, and we've seen that they've been selectively, and we've seen that there's a lot of this shantytown growing everywhere like deadly mushroom, the shanty towns that are run solely, we're told, by illegal immigrants. We now you understand why they're so growing like this in actually in the city of Johannesburg. Why there's so much chaos there? Because EFF holds the MEC for public safety. That's why. So when the Dudula members, standing outside the clinics and demanding that people, when they end, they should have their identity, South African issued identity to enter that clinics. No, then now the JMPD is sent in, according to some reports. I couldn't confirm these reports, but yeah, there's a lot of we haven't actually confirmed it whether it's actually true that the EFF did this. Legally, it's framed as keeping order. It's framed as, oh yeah, this is keeping order. Politically, it looks like shielding the illegal immigrants. This one, politically, it's like that. Legally, it's like, oh, we're keeping order. We want everybody to, get along. But politically, it's, shielding illegal immigrants. In line with the EFF's Africa for Africans stance, that political messaging has been like that. And this creates a perception problem. Our officers, paid by all South Africans who are not affiliated to any parties, protecting clinics for patients or protecting illegal immigrants, and networks behind it, the syndicates behind it. That Kwanasi gave an extensive testimony about the links of these syndicates to politicians. Yeah. So, he gave that. He substantiated this evidence. He substantiated these allegations. They're not just allegations with no substance. They're substantiated. This is police commissioner telling the citizen and telling the commissioner of inquiry that what is the extent of this rot. So, Operation Dudula argues that the illegal immigrants overwhelm clinics, schools, and jobs. Their protests, they often sometimes, yes, due to the nature of it, can be very confrontational. The EFF also has the same. They are also countered the calling to Dudula xenophobic and unlawful. They framed this JMPD deployment as defending dignity and healthcare for all. But this clash isn't just about healthcare access. It's about power, legitimacy, and who gets to define law and order in South Africa's cities. The clash at this clinic. There is a cartel connection here. And here's the part few talk about, the part that a lot of people don't talk about. They don't talk about this. It's the same thing. The things that the media and South Africa don't talk about. They don't talk about what I told you before about these medicines. Medicine aren't just consumed in clinics. They are diverted. They don't talk about this diversion. That's a big problem for me. Out of all this stuff, the big problem is this diversion. I don't care people, we don't care if people have legal or illegal status. If they're sick, they're sick. But the issue I have out of this story is the diversion. And I have a big issue about it, concern about it. But the media, the South African medias, they avoid this diversion. Again, Tanzam has told us even the media are still involved with this cartel. We're told that allegedly they are also involved with these cartels, media as well. Illegal immigrants sometimes, has been shown time and again by healthcare workers in South Africa, that they use false identity. They collect medications, often very expensive medications, and mainly they go for specific medications alleged. Some of it is trafficked across borders as API, active pharmaceutical ingredients. Also become part of the black markets trade worth millions. So they're using the tax-funded public health system that is under resources in a specific community, black community that's under resources. They targeted it because it's of the loophole that it exists. The loophole that's easy to close by just asking people to have valid identification, and a unique patient identifier that's linked to Home Affairs and other system. Very easy, and be able to track the script across the healthcare sector. It's so easy to close this loophole, okay? But they've left it open for this syndicate to thrive. Who profits? Not the patient, of course. Patients aren't profiting from this. Not the clinics, it's the syndicates. It's the drug cartel syndicates that Mkhwanazi laid it bare about the connection, the extent of this. Often with quiet political protections you have seen, you cannot tell me that in South Africa, I live in Australia, you guys know, comparing to how they protect illegal activities, it's shocking to me that politicians are doing that in South Africa. And they just use all this human rights nonsense where it's not, when you can very clearly see this is criminality you're dealing with here, but to the extent they do that. And we now know why, because Mthanam Konaze and the National Commissioner, Fanima Simono, told us why. So the ANC has been accused of ignoring corruption linked to these networks. The DL talks tough but fails to act in sector where cheap labors and illegals flows are convenient. The DA is also involved in this. There's two ministers that are linked to this in the staff of drug cartels. Allegedly, they are linked. They've been, Kandam Kwana has mentioned one of them, but there's also another ministers as well, who worked at NPA as well, that's also linked with this. So they are also involved in this. When you look at Cape Town, the extent of this drug cartel in Cape Town. So they are there. When there's a crime scene, if you find ANC, DA is also there, okay? And also the EFF. EFF, by defending these illegal immigrants unconditionally, they risk being seen as shielding the very cartels bleeding the South African healthcare system dry. So who benefits? The cartels. This isn't new. We saw it with the Zondo Commission. Big hearing, lots of truth, little accountability. Now with Mazanga, Van Rooyen warned about unlawful directives being covered up. And with JMPD, the same thing plays out. Political parties bending laws enforcement to shield power and allies, not citizens. South Africa risks becoming a state where laws exist on paper, but politics decides who gets protection and who gets punished. The law says neutrality, the reality says politics. And the cost is paid by ordinary South African citizens waiting in long lines at the clinics, struggling with medicine shortages, and losing trust in state captured by cartels, by drug syndicates, to be exact. So I'll ask you, is GMPD serving the law or political agenda? And will South Africa ever get justice or just another performance?